Doctor, brought to you by Mount Elizabeth Hospitals. Visit mountelizabeth.com.sg today to find out more for all your healthcare needs.
Wake up.
Wake up!
Wake up!
Get up.
You get out of bed this instant.
And turn it on. Glenn, Angel, and the Flying Dutchman. The Big Show on Kiss 92.
Good morning, Singapore. All right, so we have with us Dr. John Chia, medical oncologist at Mount Elizabeth Novena Hospital, Center for Genomic Health. Good morning, Dr. Chia.
Hi, Glenn. Yeah, thanks for the invite to your show.
Thank you very much for coming in. So early, raining outside some more. You made it on time.
Too true. So today the topic's going to be quite interesting because we are going to be talking about precision medicine, hereditary diseases and genomic testing. And I guess we need to...
Yeah, because we are talking among ourselves.
Yeah.
Like, what is genomic health?
What is that whole topic?
Well, you know what? We have an expert in the house. So, doctor, what is genomic testing or health?
Yes, so thanks for asking this question. So, genomic health is something that's quite new to medicine. It's about understanding your underlying biological predisposition to a particular disease. So we know that, disease, and for that matter, all of health is a function of genes and your environment. And we always talk about the big E, the environmental factors, diet, exercise, smoking, high-risk habits. But for some people, it's the big G, their genetic inherited constitution that plays an overwhelmingly predominant role in their health and their health outcomes. So genomic health is really about, seeing a doctor, that's well-versed and experienced in this area of medicine to take a comprehensive look at your risks and to assess the need to undergo specialized genetic testing to understand, the basis of this disease.
So it's kind of like what Angelina Jolie did because she found out that she was at risk of breast cancer and so she went for that double mastectomy.
Yes, that's absolutely correct. So Angelina Jolie is the poster girl for this gene, and this gene is called BRCA. It gives you about an 80% lifetime risk of breast cancer and about 60 to 70% lifetime risk of ovarian cancer.
Wow.
So BRCA is very well known, but besides BRCA, there are a whole gamut, 100 over other genes that doesn't have a very famous movie sponsor, and nobody talks about these genes. And these are the genes that we look for and that we test at the Center of Genomic Health and Genomic Medicine.
So do I need to be recommended by my doctor to go for this test, or can I opt for the test on my own?
Yes, so we always invite people to walk in, but we want to work with GPs so that GPs are a great people to bring this up and to talk with your GP as a first screen. But we do accept walk-ins. But it's important to know that these are not run-of-the-mill blood tests. These are tests which have some potential implications, on your reproductive choice. They have implications on your insurance, and these are tests that can potentially affect you psychologically.
Wow.
So for this reason, before you do the test, it's really important that you come and speak to us to make for us to convince ourselves that you actually need these tests, that you understand what you're going in for, how the outcomes can affect you, and how this thing will benefit you and it will benefit your family.
And
but
your
this is next level. This is next level. This is advanced testing already. I mean, the regular test already affects me sometimes. I'm like waiting for the results. I'm getting scared. You know what I mean?
Of course.
This is
next level.
Next level.
Absolutely right. It's next level, and it's actually the next step of evolution of healthcare, because healthcare hasn't really changed much for 300 years. And in this for genomic health, we seek to understand and predict disease before they happen. And to try and mitigate severe outcomes for certain diseases like cancer, and prevent premature deaths, from diseases like cardiovascular disease.
Yeah.
So it's highly personalized. Up to now, a lot of medicine has been, protocolized. It's one size fits all, But genomic health is really about the individual to assess your specific genetic.
Very customized.
Very customized.
We are speaking to Dr. John Chia, medical oncologist at Mount Elizabeth Novena Hospital, Center for for Genomic Health. Things are going to get even more interesting. Let's continue to talk to Dr. Chia on The Big Show TV. Up next, Lauf, This Is All for Nothing on KISS 92.
So I just have
I think let's adjust the headphones a little bit.
Okay.
Cool.
So I have a question. Like Angelina Jolie had not the privilege, but the advantage of knowing that she had this gene, and that's why she went ahead and got the double mastectomy. But for those that don't, say, have any family history or anything, when you go in for a test, do you do the DNA test for all these over 100 genes that you're talking about, or is it you do? I mean, it's each test for a specific gene.
So right now, nowadays we are moving towards panel testing. So there are many panels. There's an 8-gene panel. So for example, for cancer, I should stick to where.
Yeah, cancer.
Yeah. So for cancer, there's a panel for 8 genes, 28 genes, 64. The biggest panel is probably 100 genes. But sometimes these panels can come back negative. And then and you look at the patient, and there's so many people in the family with cancer. And what do you do with these people who come back with negative? Because you feel the gravitational pull of these, there's this dark matter
the hereditary,
that's exerting some influence on the family. But sometimes you can't pick this up with standard panels. Then we go on to ordering customized panels, bespoke tests. Sometimes we find things, on these customized tests. Sometimes we still don't find, but then it becomes interesting. Then we still put the family on the watch list, and then we try and we try to develop a customized follow-up program for them. If we cannot find a specific gene, if you do find a gene, then it's easy. Then you follow a protocol that has been developed around this gene. So, for example, for Angelina Jolie, with such a high lifetime risk for ovarian cancer and breast cancer, you go for risk-reducing surgery of the ovaries. You remove the ovaries and fallopian tubes before the age of 40. And some patients, we counsel for preventative double mastectomies.
Yeah,
Right.
That can't be easy.
So, like we mentioned earlier on, I mean, it's advanced, it's next level. I'm sure in terms of cost, it's higher than normal testing and all that. So, who will actually benefit from genetic testing, doctor?
Yeah, so I'm glad you asked this question. So the people that we focus on are people with strong family histories of cancer, strong family histories, people where there are multiple cancer members in the family, people who have very young onset of disease. So if young people are not supposed to get cancer, so if you're like 32, less than 35, and you have cancer, then you qualify. Some individuals have multiple cancers, so one person can have, breast cancer and ovarian cancer together, or breast cancer and pancreatic cancer. For individuals with two or more cancers, you need to undergo a genetic test.
So what? Okay. Yeah,
what exactly is the test? Is it just a blood test?
It is a blood test, but it's more than a blood test, because this test is a molecular microscope that looks deep into, your genes, and it predicts the future. So it's not picking up disease, and health conditions where you are now, So you can be 23 years old, you can be young and healthy, but if you carry a BRCA gene, or there's a whole variety of genes, then your lifetime risk of cancer is extraordinarily high. It's like, there's a giant asteroid that's coming towards you. It's not hitting you now, but it's on the way. And genomic health is all about trying to, avoid, this big impact with the asteroid. It's about trying to make sure that you dodge the bullet, or if you can't, that you mitigate the worst effects. So knowledge is power. If we cannot, change the cause, then it's not useful to know. But nowadays, medical technology is medical science is very advanced, and you can actually change the cause of disease and prevent diseases in many instances.
So amazing! It's amazing.
Yeah. So for someone like me, it's merely giving you a blood sample. You guys do the rest. There's nothing else.
That painless?
Yeah. So it involves a blood test, but before the blood test, you need to meet the team, and the team would involve a specialist, a doctor, and a genetic counselor. So a genetic counselor is not a doctor, A genetic counselor is someone, who's trained in counseling and in genetics, is a professional who is experienced in who understands genes, who can explain inheritance patterns to you, who can explain, the impact of a positive result and negative result to you, and who can, who's just there just to catch you to help you in your journey.
So it's more the psychological side of things.
The psychological and the medical. So it's a team, it's a tag team between these two people. Because once you know these things, it changes your life, and it's good to have someone around to catch you.
And like you said, knowledge is power, right?
Yes,
once you know.
absolutely.
So I just wanted to ask, what if you have no family history of cancer? Should you still go for this genomic testing?
Yeah, I'm glad you asked that. So in some people have advocated universal genetic testing, and there are many consumer companies that offer what we call consumer grade or consumer genetic tests.
The home kits, right?
The home kits, self-test kits. We can talk a little bit about that later because that's important. But here, I just wanted to emphasize that here in Singapore, we've adopted a more conservative approach to genetic testing. So we don't test anybody. We test people who fulfill the MOH criteria for genetic testing. So for example, at the Center of Genomic Health in Mount Elizabeth Hospital, since COVID, we've tested about 600 people, for cancer predisposing genes, and we've picked up positive mutations in about 1/3 of them.
Wow.
Yeah. So 1/3 is quite high, but it's much higher than the Mayo Clinic study. But that's because we stick to guidelines. Family history, they have cancer, or they have young onset cancer. So just to say that if you employ a strict criteria, it's not that uncommon. 1 in 3
that's a scary number
rate from our service.
Just a sec, we're going to go to traffic and then go back on air.
Like a skyscraper.
Kiss 92 Traffic.
Okay, so looking at the roads, there are a couple of situations on the MCE towards the ECP after the Marina Boulevard entrance. Look out for a broken down vehicle. Also on the AYE towards Tuas after the Bona Vista exit, causing quite a bit of congestion all the way back to the lower Delta Road exit. Avoid lanes 1 and 2. An accident has been reported. Well, the roads are wet, so please be extra safe today.
Welcome back to The Big Show and The Big Show TV. It's Good Morning Doctor, and we welcome Dr. John Chia, medical oncologist at Mount Elizabeth Novena Hospital Center for Genomic Health. Good morning once again, Dr. Chia.
Good morning, Dr. Chia. Now, we have a question that came in on our WhatsApp line. Minnie is asking whether my genome testing results whether they'll remain confidential or will they be included in my health records?
Yeah, so they are absolutely confidential, and we take medical confidentiality very seriously. And the important thing to know is that Singapore has very strict laws against genetic discrimination. Oh. So you're very well protected in Singapore. The government has put it. These laws and regulations that prevent insurance companies from discriminating, rejecting your claims.
Because you're at risk?
So firstly, they're not allowed to ask for the test. They're not allowed to ask for the test for underwriting for policies less than $2 million. And they're not allowed to ask for the test results for claims. And even if they accidentally see the results, it's accidentally submitted to them, but which is never done. They're not allowed to use it, as a basis for rejecting claims. So that's important to know. Singapore has been quite, on the ball and advanced on this in this regard.
That's very good to know.
Right. Now, for genetic testing, we've been talking about genetic testing and we're talking about it, off the air as well. I'd like to ask you once again, Doctor, genetic testing, how accurate is it?
Yeah, so for what you're looking at, the performance of the test is very accurate. It's more than 99%,
Wow.
or 99.9% accurate for what you're looking for. But as we said just now, there are some things which the whole universe of knowledge is not yet discovered. There's many things that we're still ignorant of. So for the night sky that you point your telescope towards, things that you're looking for, that you're looking for, the performance of these tests is very high. But for what science hasn't yet discovered, and there are many diseases that science hasn't characterized, then that's the blind gap, and then we rely on clinical skills, clinical judgment. But the important thing to know is that not all tests are created equal. Consumer grade tests are very different from medical grade tests.
Yeah.
So what people are familiar with because of advertising and the internet is consumer tests. And for example, there's a very famous American company that does consumer testing for BRCA. So they only test for 5 BRCA mutations, out of more than 3,000 possible mutations in the BRCA gene. They only test for 5.
Wow.
Yeah, and it's caused, 10 years later, it's caused quite a bit of a stir because they test for the big 5, but, there are 3,000 other gene mutations within BRCA that's not tested. So BRCA is a big gene, and you get many point mutations. There are many types of mutations of BRCA genes that is significant, and some consumer tests only test 5 of them.
So you would just say that's a marketing ploy?
I wouldn't say it's marketing quite. I think the consumer genetic testing has done a lot to raise awareness, and that's important. But you cannot base, health decisions on consumer tests. They can be the first step towards understanding, but there's always a danger, of a false sense of security. So you have a strong family history, you go for consumer test, it's negative.
You're like, I'm fine.
And consumer tests don't do pre-test counseling. You don't understand, what you're testing for. You don't get customized, custom, tests, and nobody counsels you on the limitations of these tests. Because not all the time you will find stuff, and you still have to manage the patient clinically.
Yeah. I'm going to ask the doctor about cancer and, whether cancer is just about genetics or whether there are environmental factors that play a role as well on the Big Show TV. It is 8:18.
Kiss 92 Time Check brought to you.
So, Dr. Ami, we're talking about genetic testing and all that, and I was hearing you speak earlier on, and Angel asked you the question as well. If there's like cancer in the family, for example, would it then be a bit more urgent for members of the family to perhaps maybe go for genetic testing to find out, if they are also at risk? But apart from that, what I want to ask you is, if a member of the family has cancer, it might not necessarily be a genetic thing either, right? They could have caught the cancer from some other, from environmental
or lifestyle.
factors.
Yeah.
So that's correct. Some cancers are just formed by bad luck, what we call random mutations.
Okay.
More and more people are understanding what are the causes of these, bad luck, random events. So there are many patients, who have cancer who do not have a what we call a big genetic predisposition. So for these people, we just manage them as per normal, But for some individuals, and the people we've tested, we've tested more than 600 people, and 1/3 of them have these big impact genes, and overnight everything changes for them and their families. There are positive outcomes because more and more there are more treatments, that are tailor-made for these people with for example, BRCA. You can have olaparib, you can have niraparib. So PARP inhibitors, specialized drugs for people with BRCA. If you have Lynch syndrome, which is a whole family of genes, very complex, you respond very well to immunotherapy for cancer, for example. So there are more and more treatments. So testing can benefit you in terms of treatment if you have the disease. It can benefit your family because it will help them, sometimes prevent the disease or, to be aware of it and pick it up and mitigate the effects at the earlier stages. So, yeah. So the goal of our center is actually, to help people live a long and healthy life, to maximize their lifespan, to maximize their health span. So because the goal ultimately is, you know, you want to live a long life, and to do that, you must
You
prevent.
need to know.
Yeah, you need to know and prevent, you know, premature
Yeah.
mortality from the big two things, which is cancer and heart disease.
Yet there are people who still don't want to know and don't want to test.
They
Don't
don't,
want to
yeah,
test.
they don't want to test.
Shida Shea has come onto our Facebook and said, and she's brought up another test, Circle DNA.
Yeah.
And its DNA reports. There's another one, I think it's called 23andMe.
Yeah.
That's what we're talking about,
We
right?
were just
now,
talking
the home
about-
tests and,
Yeah,
and
so
stuff
those are
like
your
that.
home tests.
Tho-
Yeah.
Those are home tests. Yeah,
Can't
so
be so
these
easy,
are,
right?
are consumer tests. So they are a little bit different. They're not medical grade tests.
Yeah. And I feel like, I mean, because you do the test at home, like, I don't know, you do a swab or whatever it is of your saliva, and then it gets transported to, like, the US or wherever it is it comes from. Isn't there a risk that something changes on the journey to the test lab?
Yeah, so we use, you know, you can use saliva samples, or
Yeah.
you can use blood samples. At the center of genomic health
Yeah.
in Mount Elizabeth, we use blood samples.
Okay.
And there are many reasons why we've chosen to use blood samples. The thing about using a US test and overseas tests, a lot of it comes back to counseling, and because these tests are done, you know, en masse, and is done, they are self-administered. I have instances, you know, where patients come, you know, with a report saying that they have, for example, you know, we have a patient who had BRCA picked up
On the home kit.
on one of the home kit, you know, and they weren't informed to go and see a doctor. There was no pre-test counseling. There's no post-test counseling. She sat on the report for more than a year, you know. And then one day, I think she felt a little bit unwell and she felt a little bit uncomfortable. And she came, and then, you know, then we confirmed it with a medical test. And in this instance, it was
right,
true.
right,
And then
okay.
she underwent risk-reducing surgery. She removed the breast, she removed her ovaries.
Okay.
But she did that, more
Too
than a
late.
year. Not it wasn't too late, you know, for her, luckily, but she wasn't informed she wasn't actually informed that she had BRCA and what it meant, you know. There was no medical input. So you know, it's always good, you know, to undergo this. If it's so important, you know, just start this journey
Early,
with a medical
yeah.
team.
So, having said that, do you recommend everyone to get tested this way at the Genome Center or any similar kind of center?
Yeah, so some people have advocated universal testing, but in Singapore we don't go down that route.
Okay.
So we only test people, you know, who fit criteria: strong family history, young onset of disease, you know, people with certain phenotype. Everything is customized, you know, for very, very high cholesterol, strong family history of ischemic heart disease.
So I can't just walk in and get tested.
You can walk in, and we can assess your risk, and we can explain to you, and we can try and do something that's very customized for you.
Okay. Sure.
You talk about counseling and prepping and talking people through this and making sure there's someone there to catch them when the results come. How young can a person be to take this test?
It depends on the age of onset of disease. So some conditions, you know, and I'm going a little bit outside of my area of expertise, they can manifest in children, you know. So for these diseases, you can test children, but for many diseases, like let's say BRCA, for some diseases that affect the heart, you know, they manifest or they create problems later on in life. And so we always prefer to test adults, you know, individuals who are more than 21. But there's no, you know, strict statutory guideline that says that you cannot test a young person. But we try to avoid it. If the disease causes problems later in life, we wait after 21.
What about an old person?
An old person can do it. We routinely test old people, you know, and that helps them, you know, sometimes in their choices of management of their cancer, and it definitely impacts their children. Usually I would
Just 1 second.
Okay, yeah,
Sorry.
we'll go back on
We'll continue that on the
So FD, you
radio.
can go.
Yeah.
Kiss 92 traffic.
Because it is a rather wet morning, look out for these situations on the CTE towards the AYE after Ang Mo Kio Avenue 5's exit. Avoid lanes 1 and 3. An accident has been spotted. Also on the KJE towards the BKE after the Woodlands Road exit, yet another accident. We have our WhatsApp number open all day. It's 88550920. Let us know if you spot anything.
One word to describe the weather right now. miserable.
It is kind of
pretty much.
miserable, yes.
It is pretty much. So we're talking today about genetic testing, and we're talking about the fact that we go through counseling and things like that. So, Dr. Chia, how young can a person get tested?
So there's no strict statutory age. So we generally try not to test children. We try to test people above 21, especially if their disease manifests and creates problems later on in life. But some diseases have very early onset, and so you in those instances, special instances, you can test kids.
I feel what Glenn's feeling now, this fear.
Right.
You know what I mean? Because he always says that before he goes for his yearly checkup, he's always so nervous and anxious. Then I'm thinking, I don't go for yearly checkups, but if I wanted to go for this genome testing, my heart's already racing. Like, what will I find out and how will I handle it?
But I go for testing every 6 months, and I would still be scared to go for this, to be quite honest.
For the genome testing, right?
It is a scary situation, which is why having counselors there is so important.
Wait, you go for medical checkup every 6 months?
6 months.
So kiasu.
Well, I've got a heart condition, so...
Oh, I see.
But for
6 months, every 6 months.
For
I do it
something
every
like this,
6
the
months.
genome testing, once in your lifetime is more than enough?
So it depends on what you're testing for. So these,
Okay.
clinical testing is usually a little bit narrow. So they focus on for example, a cancer panel. Later in life, if you develop other conditions, like if you want to assess for cardiac conditions, then it's a different panel. So sometimes you do tests. You do undergo multiple tests, but for most intents and purposes,
Just one.
is once.
Okay.
Right.
And then you're talking a little bit about fear. I understand. This is something that we encounter quite frequently. People, they're frightened of this foreknowledge. Lately, I found that it's not that scary. I don't want to paint a picture that spooks people, because this knowledge is power, and we've seen how it impacts people, and it changes their life for the better. And when you test someone in their 30s and they have this condition, we usually we can help them dodge the bullet. So for example, if you have BRCA and you have risk reducing surgery, for that person, virtually for their whole lives, if you take out the ovaries at a certain age, you will never get ovarian cancer. Otherwise you're on a road and with appointment towards getting cancer. So in many ways, these tests are very powerful, and they can help you dodge this big asteroid.
yeah.
That's
But
gonna
you
hit your
also
life.
never have
Yeah.
children, right?
No, that's not true.
No, is it not true?
No.
Really?
So that's a big misconception. So
Yeah, because to me, if you remove your ovaries, you're done.
yeah, so we don't remove the ovaries, up front. Usually we tell the young kid, we tell the mom, quickly allow your kids to get married fast, help them have kids. Have kids early,
Yeah.
then before the age of 40, or before the age of onset of the earliest ovarian cancer in your family, take out the ovaries. So a young person, would get married. Don't be so fussy, if your daughter is dating, don't be too fussy about the boyfriend. Quickly get married.
Oh my gosh.
Quickly get married. Have all your children, then take out your ovaries, preferably by the age of 40, and then you dodge the bullet, But there's one caveat, and I'm not sure whether I should talk about this over the radio. But more and more in many countries, the counselling involves making people aware of their choices, their reproductive choices, because there is an option for IVF. So
Right.
So if you have sex naturally, then half your offspring will inherit this mutation, and then you pass. These things can get passed on to your children. So your children, half your children will bear the same risk.
But if you do it via IVF, your risk lowers?
So in some countries, if you do it by IVF, let's say you take out 10 embryos, 5 embryos will carry the gene. You don't implant that, the 5 embryos will be completely normal, and you implant that.
Can you detect already the DNA in the embryos?
So it's called embryo selection. This is a very difficult area.
Wow.
I tread very gingerly, and I don't want to
But
talk about
it is available.
So embryo selection is something that is really relevant for what we call high penetrance genes. So if if you test 10 embryos, the 5 which are normal, the 5 which are abnormal, you don't want to implant. The 5 that are abnormal, you implant, and it stops there. The curse on the family, this genetic
my
curse
goodness.
stops, and every generation after that is normal.
Is that
That's
done in
amazing.
Singapore already?
I don't want to answer that, that question.
Don't get a doctor into trouble, can or not, Angel?
I'm
It's
like-
very interesting,
No,
yes.
but it
we
is
can,
interesting though.
yeah, we can have a we'll
Private
invite,
conversation.
Yes,
Okay.
let's go for dinner or something, and then we can
is-
talk a little bit more
Wow.
about
That's
this.
incredible.
Yeah,
That is
so,
incredible.
so usually we would refer to a fertility specialist,
Okay.
and the fertility specialist would answer and address all these questions. Yeah.
Okay,
Okay.
We won't put you on the spot then.
Well, anyway, that's all the time we have
Wait,
for
yes, yeah.
today. Anyway, it's been really, really interesting talking about this, Dr. Chia. I mean, we can go on for another half an hour talking about this, quite frankly. And I'm sure if you're listening to us right now, I mean,
You have lots of questions.
wow.
For sure.
Questions.
Yeah.
Thank you so much, Dr. Chia, for joining us today.
Yeah. Thanks, guys.
It's been a pleasure. We've been speaking to Dr. John Chia, medical oncologist at Mount Elizabeth Novena Hospital, Center for Genomic Health.
Thanks for tuning in to the Big Show's Good Morning.
Actually, stop this whole
Microphones are on.
You can.
Microphones are on. Okay. All right.
Okay.
Bye. Thanks, doctor. Thank you. Thank you.
That's crazy.
We're going to welcome Jasmine.
Jasmine Sokko is coming up, and I'm
is
sure-
coming into the studio.
I'm sure for many of you, that last 3 minutes talking to the doctor just blew your mind. Morning!
Come on, sit on down. Thank you. All right. Change the. Okay, Jasmine, my goodness. We are on the Big Show TV now, so obviously we are live already. Coldplay, huh?
Oh.
Like, how did you feel when you heard you got selected, or how did you find out?
So I got a call,
Okay.
and then it was supposedly about Coldplay, and then I was like, could it be opening? Yeah, and then I found out sometime around July last year. And during that time, I was part of this TV show in China, and we were creating this song. I was creating this song with my team.
Okay.
And our reference was Coldplay.
Oh, what?
And that morning, I got that call, and I was like, insane. Like, I was
Yeah.
just jumping around and all that, but I kept it in all the way.
Okay,
because
wow.
I didn't know if it was gonna happen, like, because
Right.
it was so surreal.
Yeah.
Yeah.
My goodness.
Well,
That's
just-
amazing. Congratulations.
Yes,
Phil.
congratulations.
Congratulations.
You know the dates you'll be opening, because we had Riley on the show as well, and she gave us, I think, a couple of dates.
I think 2 or 3 dates that she's going to be
Yeah.
opening. Yeah.
Yeah.
Do you know your dates?
Yeah, I'm performing on 23rd, 24th, and
That's
26th.
the first and second day, isn't it?
Yeah.
Yeah, it's the
Yeah.
first and second day. Wow, and then
Wow.
the 26th. Those are good days.
Okay, wait, 24th,
23rd,
24th,
26th.
26.
26th.
26.
So the first 3 days.
For 3 days.
So, how long is it? A half-hour set?
Yeah,
And so, how many songs is that?
because my
Quite a bit.
songs are really short, so
Yeah.
10 songs.
Wow!
Yeah.
Wow. And how has the preparation been for that? It's because it's in a couple of weeks. 2 weeks.
Okay.
Yeah.
It's been intense. Like, ever since this year started, I've just been in the studio with my bandmates, with my music director, and everything is kind of stressful only because like I know how big this is for me. Yeah, but it's also exciting, and I don't think there's any other thing like I want to bury myself in during this period of time.
Yeah, of course. Yeah, you got
You
concentrate.
come with a very good reputation. You know, I mean, we've been doing this for such a long time, 30 years for me. I've come across hundreds, if not thousands, of artists and all that, and you are certainly very professional. I
Professional.
can tell a professional artist just from their body language, just from how they do things.
Attitude and everything
And
else.
you're it, Jasmine. I just want to say that it's a pleasure meeting you finally. I mean, I've always wanted to meet you, even during the time where, you know, you had like the visor and certain things. And now we get to see a pretty face.
Thank you. I mean, I have never been here before. You know, like I listen to you guys.
Aw, thank
This
you.
is my first time here, so I'm really honored. It's really early, by the way.
So you're not a morning person then?
I'm not, but today I'm awake, like really awake.
Yeah, you look awake.
And Jasmine even offered to come in even earlier to do the,
do a
the
sound
sound
check,
checks
yes.
and all that.
Yeah, thank you for that.
Amazing. We really appreciate that.
Thank you.
So-
I appreciate that.
Aw. So what does prep mean for you? Like, when will you actually go to the stadium? Like, how early on? Because I think the first date is the 23rd, right? So do you get to go 22nd, 21st? Like, how early do you get to
She's
go?
never done
Really?
things like that. Unlike FD and myself, we have done all
No.
these things.
Sure. What, singing
She
on
is
stage?
yeah, singing,
I-
performing.
See, she's never done it either. There you go. Show
You
off.
know, in stadium, right? Like
Not
I've
the
been there
stadium,
to
yeah.
watch shows, but not to perform.
Yeah. So what does it? What's gonna happen?
Okay, so I don't think I would go anytime earlier than 23rd.
Okay.
But I will be doing a lot of planning on PowerPoint decks, I guess.
Okay.
Yeah, the usual like
Yeah.
planning about like how the show should be, what kind of emotions or atmosphere I want to bring to the audiences
wow.
that day, and also not forgetting it is an opening for Coldplay. Yeah, I think that is really important as well. Like everyone there, like including myself, we are fans of Coldplay.
Right.
So that's something I just want to like remind myself when I do that.
That's interesting. So you're going to plan this out, assuming using PowerPoints. Do you do that alone, or is there a team that works with you to do that?
I have a team, but I also have a habit of using PowerPoint all the time. I don't know. There's this thing about growing up in Singapore.
So your whole life is a PowerPoint?
PowerPoint.
It's not just me, right?
No, but I mean, I can see where she's coming from because it's all visual.
Yeah.
And then
yeah.
you can edit, you know,
Yeah.
and then you can put another color in if that inspires you, or another image, or another set of words and stuff. So that's quite cool.
Yeah.
But whatever works for you. you
Yeah,
know?
exactly.
yeah,
It's
yeah.
almost like mind mapping. If
It
is.
you know?
That's right.
Right? Kind of like mind mapping.
like
Yeah.
visually communicating.
Because if
Yeah.
you can't see it, then it's not real.
Interesting.
Right.
So you're
Like some people still have diaries, you know.
Oh,
They
yeah.
write
I have
stuff
a diary.
in diaries.
Yeah, I have a
Oh,
diary.
you as
Yeah.
well?
Yeah, journaling is a thing, by the way. It's very, very
My
good.
wifey has a diary
It's-
as well.
you know
Like,
why?
diary.
It's-
Who uses a
It's
diary?
very good for developing and maintaining your memory.
It is as well. You remember it.
Writing.
Yeah.
is-
Mahjong also.
And I'm not talking about writing using a computer or using your phone.
Physically writing.
writing gives you a 60% better chance of remembering what you've just noted.
But I've noted that as well with
Yeah.
like scripts and all that. If I write it,
You
I'll
write it.
remember writing it.
Yeah.
This is
You know
what
what I
my primary school teacher told me.
No, it's
This is-
scientifically
This
proven.
is also why Glenn forgets a lot.
Yes.
Yeah, so that's proof.
Sometimes
right
I
there.
purposely forget
No,
things.
you actually genuinely
You guys
forget
do
stuff.
that. Okay. Anyway, let's not squabble. We've got a guest here.
Okay, we're going to
Jasmine
go on
Sokko.
air in about 45 seconds. So when we go back on air, we'll ask you like kind of the same questions because people only listening on the radio wouldn't have heard this part.
Yeah.
Okay.
Yeah.
There's some who are listening to us and watching us at the same time. Driving, watching us, and listening to us at the same time.
Please don't
Yes.
do that.
Which
if you're
I
driving,
encourage.
drive.
They don't encourage.
No, we don't encourage it. We don't
I'm
encourage
like,
it.
it's okay, you know, do whatever you want to do.
No, don't do whatever you want to do.
You have
Okay.
the freedom of choice.
All
Okay,
right,
stand by.
coming up.
Yeah.
This is Cheyenne, by the way, Cheyenne. Cheyenne.
There you go. Say hello.
Kiss Kiss 92 traffic.
If you're on the TPE headed towards the PIE right after the Pongal Road exit, look out and avoid lane 5. A vehicle has broken down. Also on the SLE towards the CTE after the TPE exit, another broken down vehicle. There is also an accident on the AYE heading west towards Tuas after the Bona Vista exit. WhatsApp us if you spot anything else. It's 88550920.
Welcome back to The Big Show and The Big Show TV. Our second guest for this morning is a very, very talented and beautiful individual. Her name is Jasmine Sokko. You can follow her at Jasmine Sokko on Instagram. Good morning, Jasmine.
Morning, guys.
Good morning. I love it. She's bright and chirpy. Now, Jasmine, the reason we have you in is not just because of your talent, not just because of your, legions of followers on Instagram and social media, but also because you have been handpicked by Coldplay to open 3 nights while they're here in Singapore this month, actually, in a couple of weeks. So you'll be an opening act on the 23rd, the 24th, and the 26th. Congratulations.
Thank you.
Firstly, how did you feel when you heard and were confirmed for Coldplay?
I mean, that morning when I heard about it last year in July, I was actually part of a TV show and I was working with my group mates on creating a song that morning, and our reference was Coldplay.
Wow.
And then I received a phone call maybe a few minutes later, and the phone call was about opening for Coldplay, and I was just I don't know how to describe. Yeah, I was screaming and I couldn't process everything, and I didn't tell anyone all the way because I just didn't want to jinx it.
Serendipity. Did you think it was untrue, or did you think too good to be true kind of moment?
Too good to be true.
Wow.
Yeah.
It's like the universe all sort of came together.
Exactly.
It's incredible.
Yeah, that happens seldom, but hopefully it happens more to all of
Yeah.
us.
I see what you did there.
What?
Universe.
The universe.
One
Yeah.
of the Coldplay songs.
Well,
Huh?
Yes.
but
Coldplay and BTS?
it all
Yep.
came together.
My Universe.
Though. My universe. It all came together, though, I think.
It came together beautifully. So tell us what the prep's been like.
The prep has been intense, I would say. I think also because it's such a big thing for myself, I tend to put a lot of pressure on me, just me, okay, not everyone in my team. But then I am also, so I'm actually working on it almost every day with my bandmates. I'm either in the studio or practicing. And I think it is a very fulfilling process because this stage gives me a chance to sort of revamp how I want to present my music. So it is something that there's nothing else I would rather do than this right now.
Okay.
Right. What can your fans expect of your performance at the National Stadium?
I would be reimagining some of my previous songs, but I will also be dropping a lot of new songs.
Oh, nice. Okay, well, speaking of
I like
songs,
that reimagining.
Reimagining.
songs,
Speaking
yeah.
of songs and speaking of practicing, it sounds like you need all the practice that you can possibly get. We're going to give you an opportunity right now. And for your fans that are listening in, and for us here in the studio,
There's a
we
treat.
would love for you to sing something.
Thank you,
This is-
guys.
This is going to be such a treat. Here's Jasmine Sokko.
We made change after change after change after change. It's a ritual finger dance to perfect our chance. We're so afraid, so afraid, so afraid, so afraid. Are we still relevant if we fast forward the numbers? We just wanna be young gods. Glorify us, whatever it takes. We wanna be worthy. Crucify us, whatever it takes. We wanna be worthy. Community shared beliefs and a gif from our screens. There's a warm kind of fire and another we should beware. It's Someday, every day, every day, every day, we're devoted to this hell, making life seem compelling. We just wanna be gods. Glory face, whatever it takes. We wanna be worthy. Crucifix, whatever it takes. We wanna be worthy.
Awesome!
Very
Nice.
good.
Wow, that was amazing. Thank you so much.
What was the title of
Jasmine.
that song?
It's called Cyber Ritual.
Cyber Ritual.
Nice.
Can we download it already?
Yes, you can. It's on all streaming platforms.
Wow.
I'm
so
going to put my headphones on. I'm going to listen to that
It's-
song and
Yes.
have a sip on my
Loud, right?
mezcal.
Yes, absolutely. It is that kind of music. It is
Wow.
so that kind of music.
Unbelievable. Thank you
When-
so much, Jasmine.
When we come back, I've got one more. I've got a question for Jasmine when we come.
Okay, meantime, here's Lost Frequencies and Bastille. Head down on Kiss 92.
So as Glenn mentioned, that music is put your headphones on, you got a nice drink in your hand, and you're just enjoying it. Where does that?
But maybe it's
music,
just us. Lah.
I don't. But where does that music come from?
Diaries.
Oh, wow.
Yeah? Are you serious?
Seriously?
You're journaling.
I do. Okay, it helps me with songwriting. Sometimes I would just look back at my emotions.
Past entries.
Yeah. And
right.
then I try to view it from another's perspective or change it into a song.
Wow.
So most of
Oh.
it, yeah, and I try to keep my diaries pure. In a sense that I tend to write to-do lists in my diary sometimes
right,
when
okay.
I don't have that boundary. And so sometimes when I need topics, I would just revisit that and write songs.
So your songs are really
About
what
you.
it boils down to. Your songs are you.
yeah,
They're just totally you.
that's all I can do.
No, but that's brilliant. That's brilliant.
Who inspires you in terms of anyone? It could be an artist, it could be a family member, it could be a friend, it could be a celebrity, whoever. Who inspires you?
Wow, this is so hard. I think a lot of people do
Okay.
inspire me.
If you could think of one person off the top of
More
your head.
people or situations?
Both actually.
Yeah.
Everything that happened to me, everyone that came into my life and make an impact, everyone they inspire me. I guess and I look up to a lot of music artists and songwriters as well.
Yeah.
And I tend to devour their interviews and see
Okay.
what their processes are.
Yeah.
Yeah.
And then I think to name a few, one of my favorite artists would be Lady Gaga.
Okay.
Okay.
Yeah, and I think she really pushes the boundaries, and she not only create really nice and great hits, right? She also makes everyone who listens think in a certain way. Yeah.
Yeah.
So
You
if
remind me of Lady
Yeah, a
Gaga.
little bit, yeah,
bit, right?
same,
Yeah,
yeah.
yeah.
If you could, if you
Get
could
that feel.
collaborate with an artist, I mean, who would it be besides Lady Gaga? Obviously, we know you love her.
I actually like a lot of female artists. One of them would be Grimes. She's
Grimes,
from-
okay.
Yeah, she's from Canada.
Elon Musk's Grimes.
yeah.
I think they had a couple of XYZs as well, didn't they?
Yeah. I think they did. Yeah.
Okay, Grimes is
Yeah.
one of them.
Another one would be Rosalia from Spain. Yeah,
Wow, okay.
FK Twix from UK. Yeah.
Okay.
I have to be honest, I've not heard of these artists.
No, yeah, I've heard of Grimes only
Grimes I've
because
heard
of
of,
Elon
yeah.
Musk.
I'm the
yeah.
less cool one.
Yeah,
These
this is
two
true,
are-
but it is true
are
as well.
cool.
Yes,
No,
yeah.
no.
But Grimes I've heard though. Someone mentioned Grimes before. I can't remember who.
Okay, it's probably
Yeah.
in your trending quickies.
Yeah,
One of
probably.
those.
No. As in one of our DJs mentioned Grimes.
Oh,
Oh,
okay.
right. Okay. Okay.
Yeah. Could have been Daphne, I think.
Maybe.
Maybe.
So, how would you classify your music? I mean, in terms of genre, in terms of sound, what would you say you are?
I mean, I can tell you what I aspire to
Yeah,
be.
okay.
Right now, I would fall under mostly the electro pop category because most of my songs are made purely from just computers. So it's like electronic music. But then what I aspire to do and be is, I guess, to have this singular sound that would be me. And I'm in this process of like figuring out like what my identity is as a Singaporean. How do I weave that into my music? Stay true to myself and absorb like all the roots of growing up here and putting that into my music. So I guess the genre I aspire to be is unknown. Like, I just wish someone could listen to that song and go like, oh yeah, that sounds like a Jasmine Sokko song.
Yeah.
That's
Okay,
my
and they
dream.
immediately know it's
But I think
you.
Jasmine Sokko stands out already. I like this Jasmine
absolutely.
Sokko.
Yes.
I don't want Jasmine Sokko to turn into a Kid Chan. You know what I mean?
Yes,
Yeah, no,
yes,
for
I know
sure.
what you
I
mean.
mean, we
yeah.
love Kid,
No.
but
Yeah.
you're Jasmine Sokko.
But already, I mean, the song that you sung earlier was already a very unique sound.
Yeah.
You know, and if that's say something that you stick with throughout your career, then clearly people who already love you will identify that, and then obviously the fans will grow. You know, so but that sound is also very,
So
very
I
unique.
think you stand out the most out of all our local
artists, yeah,
right now.
as being not cookie cutter.
Yeah.
Yes.
You're definitely
yes.
not cookie cutter.
Yeah.
That's for sure.
I mean, we've got a whole bunch of really, really talented individuals, and we love all of you. But you really do stand out.
Yeah.
You know, Jasmine.
Thank
So-
you. I really do struggle with fitting into.
No, which is why you stand out, right? But is singing something you've always wanted to do?
No, actually.
Okay, so what?
I wanted to be a songwriter, and I think I was schooling in SMU, and I wanted to be a researcher. Like that was what I thought I would be growing up. Yeah.
Because of society and parents, or
Yes.
okay,
Yeah. And
Okay.
I had this like dream of working in Google when I was in school. Yeah. But somehow like music happened, and I'm really grateful. I just didn't think that it could be a career path in Singapore.
Yeah. What did parents say when music happened?
They were like, yeah, you can keep this hobby,
but
so
make
long
sure
as-
that you finish school.
Yeah, there you go. They're probably listening right now.
Yeah, okay. Have
You
something.
expect questions from grandpa.
Yeah,
of course.
and mommy.
Have something to fall back on. Like, you
Always.
know, you
Yeah,
can have
yeah,
this
yeah.
passion.
Yeah, so true, so true.
But they're okay now. Obviously, they're very
for
encouraging.
sure.
They're so supportive. They're tuning in right now.
Awesome.
What are their names? What are their names?
So convert your parents.
What are your
Hello,
parents' names?
Stephen.
Good morning,
Shirley.
Stephen. And
Stephen and Shirley.
Good morning, guys.
Good
Wow.
morning.
So lucky to have
Thank
such
you
a
guys. You're
talented
gonna hug
daughter.
me when I'm
I'm
home.
sure they better hug you real tight.
Very interesting. A woman who knows all about following dreams. May Schooling, Joseph Schooling's mom, the swimmer, has said to you, go follow your dream.
There you go.
She's living it.
You're living it.
Okay, hey, we have something right now. I would love to see this photo. Photo of Jasmine doing something.
Ooh,
okay,
what
come
is
on,
it?
let's
What's
flash this.
Proud of you. What's
I'm
happening
in the
here?
little corner
On
at
the left.
On the
Okay.
left.
That's me.
Okay.
Okay.
And that's Ronaldo, clearly. And where was this?
This was in 2019 in Spain. I was there for MTV EMA.
Oh, right.
Yeah.
Okay.
And then I'm introverted, by the way. And then back then when I was at the award, like I was really shy, and so I was standing behind.
Okay.
And then somehow like this picture happened.
Yeah.
Yeah, and then I didn't think about it that much until like a few weeks ago, my cousins came down, like from the States, they came down, and then they asked me like, what's your biggest accomplishment so far? And then my brother just like chimed in and said, that one picture. This one picture.
Photobombing Ronaldo.
Yeah.
Cute.
And I was like, I don't even remember it.
Okay, wait.
Okay.
Hang on one sec. Hang on.
Post Malone and Sway Lee. This is Sunflower right here on Kiss 92. All the great songs in one place. Our guest for this morning, our second guest for this morning is Jasmine Sokko, who will be opening for Coldplay on the 23rd, 24th, and 26th of this month. We've just been chatting about, how much she's been rehearsing for this, how much she's looking forward to this. And we also just flashed a really interesting photo of Jasmine photo bombing Cristiano Ronaldo at the European MTV Awards in 2019, you were saying.
Yeah, if you missed that, you can always go back on our YouTube and Facebook channel and just rewind to that moment where she photobombed.
I think all of you that enjoy photobombing, you've now lost out because you haven't photobombed Ronaldo.
Now, Jasmine, I have to ask you this question because there's some people who are just, wondering. Like when you first started out, right? You had the visor. You had what else did you have? You had goggles.
Yeah.
Yeah.
Yeah, I think name whatever you can put on your face. I think I had it.
So why did you do that at the start?
In the beginning,
Yeah.
I was schooling and I wasn't sure if I wanted to pursue music full time. Like I didn't think that it would be possible.
Okay.
And at the same time, I just felt that having a mask on was something that a lot of my electronic music heroes were doing. Dead Mal, what else? Like a lot of musicians I look up to, like they have these personas.
Okay.
And I wanted to separate that from my actual life. And I guess it felt like a Hannah Montana thing to do as well.
Okay.
And back then, when I started out, I felt that the mask was also an extension of my personality.
It was like
Because-
your stage presence versus you in school and stuff like that.
Yeah.
For a while, I mean, you were known for that, right?
Yes.
So what made you take it off then?
Yeah, that's the big question.
I knew I wanted to take it off at some point because the mask was just getting smaller.
Every year.
And then it no longer like served the purpose of covering who I am. And I guess once it loses that meaning, it started holding me back from exploring other stuff that I could work around with when it comes to trying different looks.
Yeah.
Right, okay.
And how have your fans received the fact that you're not having the mask on anymore? You've taken it off.
I feel like, okay, I don't know if they're shocked. I'm not sure about that because I feel like I revealed different parts of my face over the years. So, yeah, but then they're still really supportive. And I
Right.
think one of the most touching comments I get would be the ones that talk about how they were there for the music.
Oh, nice.
Yeah, so
okay.
that made me feel like, the mask was a part of it, but it wasn't everything.
Right. But you didn't ask your fans if you should take the mask off.
Okay, here's the thing. I feel like when I take the mask off, I should first and foremost answer to myself.
Right.
Yeah,
Yeah,
you don't
and-
need permission from anyone else.
Yeah, and then not everyone's gonna like it, but I think that if I could answer to myself, that would be enough, and I'll stick with that decision.
Yeah.
Nice, I like
That's
that.
great.
That's
Yeah.
nice.
That's
Yeah.
great. Yeah.
Very cool.
Yeah. Okay, thank you very much, Jasmine, for joining us. It's been such a pleasure. You see, time has just flown by.
8:57, yes.
If I didn't get an indication from my producers, I would have thought like we've been only talking for 10 minutes.
No, we haven't. Almost half an hour.
Exactly. Okay, well, thank you very much, Jasmine. Anything you want to say to your fans who are tuned in right now?
Guys, take care of your health, have a great year, and get enough rest.
Oh, I like that. And good, all the best for Coldplay.
Yeah.
Thank you.
And
Yes,
anything new in the pipeline for Jasmine Sokko in 2024?
I will be releasing more songs.
Okay.
And I'm looking forward to this year, but I don't have a lot of concrete plans because I want to leave things open just in case, something like the Coldplay opening opportunities
Shifts, yeah.
comes
Right.
by. So, yeah, thanks for having me. It's such a fun morning.
Oh, thanks for being here.
We'd love to have you on the show again at some time.
Yeah.
Although it's really, really early. But anytime, you're open to coming back on the show, you'll be most welcome.
With
Thank
some new
Jasmine.
music. Yeah, all the best.
Okay, please follow Jasmine Sokko at Jasmine Sokko. And once again, all the best to Jasmine for the Coldplay concert, 23rd, 24th, and 26th. If you're going to be there, you're in for a treat. All right. Thank you, Jasmine.
Thank you.
Wake up feeling good. The Big Show.
In the